Health Secrets from a 91-year-old active physician. Hello, I'm Dr. James Mitchell, a 91-year-old practicing physician. Did you wake up with aching joints this morning? Was getting out of bed painful? I understand completely. I was there too. 20 years ago, I dreaded mornings. The pain was so severe I wondered if this was the end. But today, at 91, I still see patients in my clinic every day. On weekends, I play golf. How is this possible? Many people ask me about my health secrets. They expect to hear about exotic herbs, expensive supplements, or complicated exercise routines. My answer is surprisingly simple. I've simply taken care of 4 neglected areas inside our bodies that most people ignore their entire lives. Let me be honest with you. As we reach our 70s and 80s, we give up on so much. We tell ourselves, I'm old now, what can I do? We accept that we can't keep up with our grandchildren. We abandon hobbies like hiking or traveling. Some nights, we go to bed wondering if we'll even wake up the next morning. I know that fear intimately. But in my 60-plus years as a physician, I've discovered something remarkable. People who age healthily all pay special attention to managing specific body areas. If you listen to this entire message today, your remaining years could change completely. Do you think it's too late? It absolutely isn't. Trust me on this. The 4 critical body areas. Our body is an interconnected system. Certain areas act like major highway intersections. They have a decisive impact on overall health. The 4 areas I've identified are surprisingly simple to manage. With just a few minutes of daily care, your body functions smoothly, your immune system strengthens, and your energy soars. These 4 areas are your feet, armpits, inner thighs, and back with scalp. Why are these areas so crucial? Beyond simple hygiene, these are where major blood vessels, lymph nodes, and nerve networks concentrate. The condition of these areas essentially determines your whole body health. Do you want to live vigorously after 75? Then starting today, you need to pay attention to these 4 areas. We commonly view wrinkled skin, gray hair, and joint pain as inevitable symptoms of aging. But based on my 60 years of medical experience, most of these symptoms can be greatly improved with proper body care. Don't give up just because you're older. It's never too late to start. In fact, the older you are, the more dramatic the effects of this care method. Part 1, feet, your second heart. How much do you value your feet, those precious body parts that carry you tens of thousands of steps each day? When 78-year-old Margaret Chen came to my clinic, she could barely walk. Doctor, my feet hurt so badly that even going to the bathroom is torture. I feel like my life is over, she said, tears welling in her eyes. I examined her feet. Deep calluses had formed, dry skin was cracked everywhere, and between her toes, moisture and bacteria had caused inflammation. I asked, how do you care for your feet? Care? I just wash them. That was exactly the problem. We think simply washing our feet is enough. But feet aren't just transportation. Feet contain over 7,000 nerve endings, all connected to our internal organs. Eastern medicine calls these meridians. Western medicine now acknowledges this connectivity too. I always teach my medical students the feet are the second heart. The blood vessels and muscles in the feet help. The heart pumps blood throughout the body. Remarkably, foot care improves cardiovascular health, stabilizes blood pressure, and even enhances sleep quality. The 4-step foot care method. Step 1, soak in warm water for 30 minutes. Water temperature should be slightly above body. Temperature around 104 F is ideal. If too hot, it can damage skin. 30 minutes of soaking dilates foot blood vessels and promotes whole body circulation. I recommend patients add a handful of Epsom salt to the water for even better swelling relief. This releases fatigue accumulated in your feet all day and quickly reduces leg swelling. It's especially important for those with diabetes or high blood pressure. 78-year-old Dorothy Williams overcame 20 years of insomnia this way. Dr. Mitchell showed me how to soak my feet in warm water every evening. At first I thought, what difference could this make? But within a week, everything changed. For the first time in 30 years, I slept deeply without medication. Step 2. Gently massage the soles. The soles contain reflex zones connected to organs throughout the body. Simply massaging these areas can stimulate internal organ activity. I massage my soles every morning when I wake up and every evening before bed. Use your fingertips to massage your soles in circular motions. Focus especially on the heel and the ball of your foot. One of my patients resolved 15 years of constipation thanks to this massage. Step 3. Thoroughly clean and completely dry between toes. Many people overlook this. Between the toes is moist and dark, the perfect environment for bacteria to thrive. Skin problems here can affect whole body health. You must thoroughly wipe and completely dry between your toes with a soft towel or cotton swab. This is especially critical for diabetics. 82-year-old Robert Williams came to my clinic with an infection that started as athlete's foot between his toes and progressed to the point where he nearly needed toe amputation. Fortunately, proper treatment and care led to recovery, but this suffering could have been avoided with proper toe care. Step 4. Use moisturizing cream and non-slip footwear. In older age, skin becomes dry, and sensitive foot skin is no exception. After bathing, keep feet soft with body lotion or specialized foot cream. Also, always wear non-slip slippers at home. Walking barefoot on hard floors isn't good for foot health. In my experience, proper footwear alone can reduce foot and knee pain by over 30% for those over 70. Margaret Chen consistently practiced these 4 care methods for 3 months. The results? Dr. Mitchell, it's a miracle. My feet don't hurt when I wake up anymore. Last weekend, I walked around the neighborhood park with my grandson, something I couldn't have done a year ago. Part 2. Armpits, your natural detox center. Do you think armpits are simply where you sweat? Let me tell you, from 60 years of medical experience, armpits are our body's natural detoxification centers. Let me share 75-year-old Helen Martinez's story. For over 20 years, she suffered from seasonal bronchitis and allergies. Every spring and fall, she visited hospitals for antibiotics and steroids. Doctor, taking antibiotics every season has become routine. Will I have to depend on medication my whole life? When I examined her armpits, the skin was irritated and red. Sweat glands were blocked, and her lymph nodes were slightly swollen and firm. Do you know there are over 20 important lymph nodes in your armpits? These lymph nodes are key parts of our immune system. They remove toxins from blood and produce white blood cells that fight infection. Unfortunately, most people think armpit care is simply about odor removal. They spray strong deodorants and focus on blocking sweat glands to prevent sweating. This is precisely the problem. Armpit sweat glands are important pathways for expelling toxins from the body. Artificially blocking them causes toxins to accumulate inside. The 4-step armpit care method. Step 1. Wash gently with fragrance-free mild soap. Body washes or soaps with strong chemicals destroy the armpit's natural balance. For 60 years, I've only used mild soap with natural ingredients. After wetting armpits with warm water, gently wipe in circular motions with mild soap. Scrubbing too hard can irritate skin and actually disrupt balance. I recommend soap containing green tea extracts or coconut. Oil these calm skin while naturally providing antibacterial action. Step 2. Completely dry after showering to prevent bacterial growth. Armpits are moist and warm, a good environment for bacteria to thrive. After showering, completely drying armpits with a soft towel is important. I recommend patients use a hairdryer on cool setting. This completely dries armpits and prevents bacterial growth. 83-year-old Frank Johnson resolved 20 years of armpit rash and itching with just this method. Step 3. Use naturally derived deodorants. Avoid deodorants with chemical ingredients like aluminum or parabens. These ingredients block sweat glands and can affect lymph node function long-term. For over 60 years, I've used natural deodorant made from baking, soda, and coconut oil. It eliminates odor while allowing sweat glands to function naturally. Another method is applying diluted apple cider vinegar to armpits. The slight vinegar smell disappears quickly and naturally regulates skin pH balance. Step 4. 2-minute morning lymph massage to promote circulation. This is what I emphasize most to patients. Invest just 2 minutes every morning. Gently massage around your armpits in circular motions with your fingers. This promotes lymph circulation and aids toxin elimination. The method is simple. Raise your arm overhead and gently massage around the armpit from neck toward chest with the opposite hand. 1 minute per armpit, 2 minutes total is sufficient. After practicing these 4 methods for 2 months, 75-year-old Helen Martinez experienced amazing changes. Dr. Mitchell, I can't believe it. For the first time in 20 years, fall arrived and I didn't get bronchitis. Getting through autumn without antibiotics feels like a miracle. Part 3, Inner Thighs, Key to Circulation and Liver Health. Place your hand on your inner thigh. Do you feel a pulse? Right there, in the groin area. Major blood vessels and lymph nodes of our body converge. In my 60 years treating countless patients, I've discovered something remarkable. The health of the inner thighs directly affects liver function and blood circulation. Let me share 71-year-old Barbara Thompson's story. Every night, she suffered from swollen, tingling legs. The symptoms were so severe she couldn't sleep without medication. Doctor, my legs tingle every night so I can't sleep. I've been to several hospitals, but they can't find the cause. I examined her inner thighs. The skin was dry and cracked. Groin. Lymph nodes were slightly swollen and firm, and blood tests showed slightly elevated liver values. The inner thighs aren't just skin. Major circulatory structures converge. Here, femoral arteries and veins, inguinal lymph nodes. Poor circulation in this area can cause leg swelling, varicose veins, and even affect liver function. Inner thigh care method. Step 1. Wash gently with warm water and mild soap. Many people don't properly wash their inner thighs when bathing. Especially as we age, stiff bodies make this area hard to reach. After thoroughly wetting inner thighs with warm water, wash gently with naturally based mild soap. Strong chemical body washes can harm skin. I show patients how to wrap a bath sponge or soft towel around a long stick. This way you can wash inner thighs well without bending much. Step 2. Wear breathable cotton clothing after washing. Inner thighs are moist and warm, prone to skin problems. After showering, dry completely with a soft towel and wear breathable cotton or linen underwear. Especially as we age, avoid synthetic underwear like polyester or nylon. These fabrics don't absorb sweat and can irritate skin. I recommend patients wear 100% cotton underwear in generous sizes. Too tight underwear restricts blood flow and lymph fluid circulation. 76-year-old Paul Jackson insisted on tight briefs. His whole life, until severe skin disease developed on his inner thighs. After switching to loose cotton underwear, symptoms improved significantly within 2 weeks. Step 3. promote circulation with simple stretches like butterfly pose. The best way to improve inner thigh circulation is butterfly pose and thigh stretching. Sit on the floor with soles of feet facing each other. Hold your feet with both hands and gently lean upper body forward. Move knees gently up and down to release inner thigh muscles. Worried it's too difficult? For those concerned, there's an easier method you can do lying in bed. While lying down, bend one leg and let the knee fall to the side to stretch the inner thigh. I'm 91 and still do this stretch for 5 minutes every morning. This alone keeps blood and lymph flowing well, keeping my legs light all day. Step 4. Apply moisturizer and powder to prevent skin friction. As we age, skin becomes thinner and drier. Inner thighs especially experience much friction and need good care. I recommend patients apply natural moisturizers like petroleum, jelly or coconut oil after showering, especially in summer. Lightly sprinkling cornstarch powder is also good for reducing friction from sweat. After practicing these 4 methods for 1 month, 71-year-old Barbara Thompson experienced amazing changes. "Dr. Mitchell, I can't believe it. My legs don't tingle at night anymore. I can sleep without medication. Leg swelling has decreased significantly, and the hospital said my liver values returned to normal too." Part 4. Back and scalp. Brain health and nervous system function. Do you think fatigue and memory decline are simply due to age? 75-year-old Patricia Davis recently experienced rapidly declining memory and constant fatigue. She feared this was the onset of dementia. "Doctor, sometimes I even mix up my grandchildren's names. Is this the start of dementia?" I'm terrified. I examined her back and scalp, stiff, hardened muscles, dry scalp, significantly reduced blood circulation. As expected, these aren't just areas to wash. They're directly connected to the central nervous system and play important roles in blood supply to the brain. Medically speaking, neck and upper back muscles directly affect blood vessels and nerves going to the brain. When these muscles tense up, blood flow to the brain decreases, and consequently memory and cognitive function decline. The scalp is the same. Scalp health directly connects to brain health. Poor scalp circulation reduces nutrient supply to the brain, which can cause declining thinking ability. Back and scalp care method. Step 1. Wash your back with lukewarm water and soft brush. When bathing, most people can't properly wash their backs. Especially as we age, stiff arms often can't reach the entire back. I recommend patients use soft bath brushes with long handles. After wetting the back with lukewarm water, wash in soft circular motions from spine outward, like massaging. This improves back circulation and releases tensed muscles. It also improves blood flow to the brain, clearing the mind. 79-year-old Charles Anderson said after practicing this method, "Even just showering seems to clear his head." Step 2. Improve blood flow to brain through scalp massage. Scalp massage has remarkable effects on brain health. The scalp contains numerous blood vessels, so proper massage directly improves blood flow to the brain. Every morning and evening, I gently massage my entire scalp with my fingertips. The method is simple massage. Your entire scalp, gently in circular motions with fingertips for 5 minutes. Don't press too hard. When shampooing, it's also good to massage the scalp gently. The back of the head and temple areas especially have important blood vessels going to the brain, so massage these areas carefully. After starting this massage, 75-year-old Patricia Davis said, within 2 weeks, her mind cleared and memory seemed to improve. Step 3. Keep spine flexible with simple morning stretches. The spine is our nervous system's highway. Spinal flexibility directly affects nerve transmission and blood flow throughout the body. At 91, I still do simple spine stretching for 5 minutes every morning. The method is easy. Sit on your bed and slowly turn your head left and right, move it forward and back. Then slowly rotate your shoulders and gently bend upper body sideways. Too difficult? For those worried, here's an easier method you can do lying in bed. Lie with knees bent and simply lift and lower your buttocks. Slightly this alone maintains lumbar spine flexibility. One of my longtime patients, 83-year-old William Parker, said chronic lower back pain that plagued him for 15 years. Greatly improved within 1 month of starting this stretch. Step 4, 5 minutes of evening massage for deep sleep. 5 minutes of back and neck massage before bed greatly helps achieve deep sleep. This releases tensed muscles running along the spine and relaxes the central nervous system. The method is simple. Put massage, cream or oil on your hands, and gently massage from neck to lower back. Releasing tension in the neck and shoulder area is especially important. If difficult to do alone, try putting 2 tennis balls in a sock, placing it on the floor, and slowly moving while lying on it. This effectively releases tensed back muscles. After practicing these 4 methods for 2 months, 75-year-old Patricia Davis experienced amazing changes. Dr. Mitchell, it's a miracle. I no longer mix up my grandchildren's names. My mind is much clearer, and I'm full of energy. My family says I've changed too. Making it a daily habit, the 5-minute miracle. We've explored 4 critical body areas and their care methods: feet, armpits, inner thighs, back and scalp. Now you understand how important these areas are for our health. But you might think, that's too much. How can I manage all of this? Don't worry. Through 60 years of medical experience, I've found the most effective yet sustainable method. Let me tell you about creating healthy habits, the 5-minute miracle. The most important principles. First, don't try to change everything at once. Gradual change is most effective and sustainable. Focus on one area per day of the week. Make Monday Foot Care Day, Wednesday Armpit Care Day, Friday Inner Thigh Care Day, Sunday Back and Scalp Care Day. Other days, just focus on basic washing. This lets you intensively manage each area without burden. Second, invest just 5 minutes per area. Just 5 minutes per area. 5 minutes is time anyone can make. As a 91-year-old practicing physician, I tell you, the most important secret to health isn't something grand. It's consistently practicing small habits. Every morning when I open my eyes, I first massage my soles. After meals, I do 5 minutes of thigh stretching. During evening showers, I focus on back brushing and scalp massage. All of this takes less than 15 minutes daily. Third, connect new habits to daily routines. Connecting new habits to daily routines makes them stick easily. For example, massage feet while drinking morning coffee. Do thigh stretches. While watching TV news, do back. Brushing and scalp massage while showering. Do armpit lymph massage before bed. This way you can't make excuses about not having time. Fourth, believe in the power of gradual change. It's too late? Absolutely not. I've treated countless elderly patients for over 60 years. The most remarkable transformations came from those who started these care methods. In their 80s, even 90s. 86-year-old Betty Harris started the 4-area care method, and within 6 months reduced her blood pressure medication by half and resolved 10 years of insomnia. Doctor, I can't believe I can be this healthy in my mid-80s. Now I look forward to every morning. 93-year-old George Peterson used this method to greatly reduce long-time pain and became able to walk without a cane. They say late learners are dangerous. I never knew late-learned health methods could be this effective. You don't know how happy I am to walk in the park with my grandson. Final words. My final advice: consistency is most important. As a 91-year-old practicing physician, I confidently tell you, the secret to living healthy and long isn't difficult. It's simply paying attention to body areas we've neglected our whole lives. Start today. Just properly managing these 4 areas: feet, armpits, inner thighs, back and scalp will bring amazing changes to your health. Small changes transform lives. At 91, I still treat patients, hike weekly, and maintain the stamina to play with my grandchildren. You can do it too. Remember, it's never too late to start taking better care of yourself. Stay healthy, and I'll see you next time, when we discuss maintaining sharp memory as we age. Dr. James Mitchell, cheering you on.